Hi, on today's Ask the Expert, I'm here with Shelley Jones, maternity nurse navigator here at Halifax Health. Thank you for being with us today.
You're welcome, Ashley.
We've gotten a lot of questions online in regards to COVID-19 and pregnancy. So Shelley's here today to just kind of answer some questions for us, as well as tell us what Halifax Health is doing to keep mothers and babies their very safest that they can be. So to start off, is there a special concern right now with pregnant women and COVID-19?
Yes, of course, there's always special concerns with pregnancy. The moms, as we know, are immunocompromised during pregnancy. So even during flu season, and that's why we're so diligent in having moms go for their flu shots, because we know they are immunocompromised. So it's even more of a heightened awareness with this COVID-19 because it is new. We don't know what to expect. And there aren't many studies out on it, so we want to be sure to keep our moms safe and free from this virus.
What can moms do right now to protect themselves from that?
Well, they need to follow recommendations set forth by CDC, the basic social distancing, good hand washing, just staying away from possible sources of infection because they are more susceptible.
What's the concern right now if a pregnant woman were to get COVID-19?
Well, the concern is it's a virus, they're immunocompromised, and we don't know what the long-term effect is. There aren't enough studies, unfortunately.
In this case, we've heard a lot of feedback from Facebook. Women are concerned if they were to have it, could they pass that on to the baby? What is it looking like as far as studies go?
Well, the studies thus far have shown that the virus is not contained in the amniotic fluid, cord blood, or breast milk. This is all very positive. So we're not seeing any transmission through these secretions, which normally things do pass. So that's very positive for moms.
Okay, so when you hear a report about an infant getting COVID-19, that's likely something that didn't happen in utero, happened after?
Not that we know of.
Okay.
Not that we know of.
Is there anything we know yet about long-term effects of a baby who is exposed? No?
Not yet.
Okay.
There's just not been, it hasn't been around long enough.
And that's what's so scary about it, I guess,
Right.
is that, there's not enough to know. It's all new territory for everybody. If there is a pregnant mom out there who is showing these signs and symptoms that you talked about, I know it's high fever,
Right.
coughing, what should they do?
Right. If mom has any of the symptoms of the COVID-19, like Ashley said, the high fever, the cough, or any respiratory distress, you need to notify your physician immediately. Let the office know so that they can give you direction on how to care for yourself and to care for the rest of your family. We at Halifax have special precautions. We have a plan in place if a mom comes in who is positive COVID-19, depending on her gestational age, whether she needs hospitalization and is not ready to deliver yet, or if she is, it is time for her to deliver. We have special rooms designated with all the precautions in place to care for these women. So if they do need hospitalization, as always, we are here.
Very good. So a woman they need to talk to their provider. The provider is going to talk to Halifax Health.
Correct.
And we're going to be ready when that happens.
We are ready.
Perfect.
We're ready now.
Good. Well, we're here every day, so we see the different changes that have been made over the past few weeks to prepare and to keep our patients and visitors safe, as well as our staff members. And that includes badging at the front desk. There's a list of screening questions. But what is the differences that a mother, a pregnant woman's going to see, as well as the family, when they get here to Halifax Health to deliver their baby?
Right. The patient, as well as the family member, will go through the screening process, just like anyone else coming into our facility. And the moms are only allowed to have one support person with them during labor and delivery. This is also the same for our C-sections. We are still allowing one support person to be with mom, and no visitors under the age of 12. No children at all are being allowed in our facility currently.
That's tough. This is a special time, and so I'm sure everybody, when you have that baby, you want everybody to come meet them. But it's safety's at the utmost importance here, and just something new that we don't know what we're dealing with entirely yet. What about if somebody were to have a doula? How does that work?
Well, my recommendation for patients who have doulas arranged for their birth experience would be that you call your doula and have them come to their house as normal and have them labor with you at home as long as possible. Really, that's their expertise, and that's the goal of a doula, is to help keep you relaxed and help you through the process. So they can come to your house, work with you at home, and then when you both agree that it's time to move to the hospital environment, then you can make an informed decision who would be the best support person to be with you in the hospital for the birth process.
Very good. Well, and it's good to know this on the front end so you can prepare and have those conversations ahead of time, and you have a plan in place so when that happens. Well, thank you very much for being here, Shelley. We appreciate it, and kind of giving us some light in this time that's very fickle. Hopefully we won't be talking about COVID-19 for very long.
I hope not.
But we appreciate you so much, and thank you for joining us today.
Thank you.